welcome back to the series of live sessions. So today we are coming with another exciting topic, which is continuation of the Nursing Foundation second unit, Healthcare Delivery System. Okay, so yesterday class we have thought about a lot of things related to the healthcare delivery system in India. Especially in this today class we are going to speak about the hospitals and the classification of the hospitals and what kind of care and what are the functions, interdisciplinary team which will be present in the hospitals. Okay, so those kind of topics we are going to be discuss now. Yes, we will start. Okay, so if you have any doubt, please do comment down, or you can DM to us in Instagram also. If you have any kind of doubts which is related to our course, you can do that. Our WhatsApp number will be given in the description box. You can contact through that also. Okay, so without wasting the time, today we are going to start the classes. So today's class is all about the hospitals. Okay, so very first we are again going with the hospital classification, because yesterday also I have taught regarding the classification, even though today we are going to know bit of recap regarding the hospital classifications. Okay, healthcare agencies, usually hospitals are the institutions where we are going to be provide care to the sick people. Okay, so that is a place. Okay, hospital, which is the word which is given by the derived from the word Latin. Okay, from the Latin word which is derived and which is called as hospitalis. Okay, hospitalis, which turns to derive from French. After that, from the French, one word has been came, that is what hospice. Hospice means host or guest. Okay, so you have to go for an hospital as a guest, which means you are not going to be staying in the hospitals. You are going to take care of you as needed according to your medical conditions, and as well as you are going to know about your conditions. Actually you are going to know about the conditions, getting the consultations, getting the treatment. Okay, so as a guest you will go and you will get whatever you want, and you will come back to your proper places. Okay, so which is related to health means you are going to get the treatment and you will be recover and you will get back to your previous state. Okay, so that is what the hospital. Again I will tell you, hospital is the word which is derived from the Latin word hospitalis. Again it is going to be turns to derive from the French word hospice. Hospice, which means a guest, or we can say it as a guest or the host. Okay, and the hospitum, the Latin word, it is also Latin word hospitum, refers to the place where the guests are received. Okay, so here you have to okay, so which is derived from the Latin word called hospitalis. Okay, so hospitalis, and the that in from French also it turns gives a word which is called hospice. Hospice. Okay, so hospice, which means guest or host. Okay, which means guest or host. And another one word is there, that is what? Hospitum. One second, I will confirm with that. Yeah, hospitum. TUM. So which means the place where the guests are received. Sound will come. That sound will not come. Okay. Okay, so now you got an idea regarding the hospital. Okay, so the hospital is the word which is comes from the Latin word called hospitalis, and again it is going to be turned. Again it is going to be turned the French word, that is what? Hospice. Hospice means guest or host. Okay, so that is very clear here. You can, hospice means guest or host. Again one Latin word is there, that is what? Hospitum, which means the place where the guests are received, or means where the guests are going to be take treatment or something else. Okay, whatever there according to their need. Okay, especially if it is come to hospital means we are going to focusing on the healthcare delivery only. Okay, which means treatment only, medications only. Okay, so the definition according to the WHO, hospital is an integral part of the social and medical organization, the function of which is to provide for the medical organization, the function of which is to provide the medical care for the population, complete health care, both curative and preventive, and whose outpatient services are reach out to the family and its environment. The hospital is also a center for training of a health worker and biosocial research. Okay, so here we are providing the social and medical care. Okay, social and medical care to the population. Okay, to the population, medical care to the population. We are going to reach out to the population. Okay, so to the community also we are reaching. Okay, so there we are going to provide a care for the people or the population in order to provide the social and the medical care. Okay, next one is that here these are the institutions or the organizations which they are going to provide a care to the population, and here the services, the main function of the hospital is to provide the services to all over the all over the population with a complete proper care. Okay, hospice care we can say, no, whole, which means preventive and curative, promotive kind of healthcare facilities we are supposed to provide to the patients. Okay, or the population. Okay, so and along with that, here hospital is also a center for training for the hospital workers. Okay, healthcare workers, and biosocial research also that can be conducted in the hospitals only to upgrade the system. Okay, so this is all about the definition of the hospital. Okay, so definition also clear in that only, so you can write it down in the examination if they are asking regarding the hospitals. Okay, so this is also one of the very important, either for 2 marks there may be a chance to ask about the hospital and type of hospitals. Okay, most probably here what will come in this particular unit means interdisciplinary team of the hospital which will come. So even though while writing that one you have to write the definition of the hospital is a mandatory, so just go through the WHO definition. Okay, so WHO definition says that hospital is a institution, organized institution, integral part of the social and medical organization, and the function of which is to provide for the population complete health care, both curative, preventive and whose outpatient services reach out to the family, okay, and its environment. So that is what regarding the hospital. Okay, so next we can move towards the classification of the hospital. Okay, so here a few points are there regarding hospital, that also I will teach you. It is an establishment for temporary occupancy by the sick or injured. Okay, so it is not the thing which is we can't able to make the people to stay there. Okay, so they are not so supposed to going to stay for so long time, that also will be comes in the classification, but they are not going to be stay as a permanently. Okay, so they can't able to stay in the hospital permanently. So the very first that is the thing, so it is established for the temporary stay, okay, of the patient to take or the sick person or injured. Okay, the next one is, it is a place where people who are ill, okay, it is a place where people who are ill, this is the place. So place for the ill people, ill population, sick population. Okay, so who are not well, no, for them this is the place to go and take the treatment. Okay, so or injured, treated and taken care of by the doctors and the nurses. Okay, so it is a place there we are getting the doctors and the nurses to get the treatment for the illness or the injured things of the people or the population. Understood? Next one is that hospital is an institution that built, staffed and equipped for the diagnosis of the disease, for the treatment both medical and surgical of the sick and injured, and for their housing during the process. The modern hospital also often serves as a center for investigation for the teaching hospitals. Okay, which means it is a very well developed, built, and it is going to be provide with a very skillful staff that we can able to get the treatment for both the medical and as well as the surgical subjects. So means patients or sick people or injured, suppose any kind of fall or any kind of accident which will leads to the fracture, by the time there may be chance to do the operations. Okay, or suppose any kind of surgical condition, so for that reason we need a well equipped OT should be there in the hospital. Okay, so those are the mandatory things to design the hospital. So those kind of things which where we are getting that we will called as a hospital. Okay, so these are the features of the hospital. So how it will be there and what is the criteria is there, that and all will be going to be you have to understood here. Okay, understood, no? Next we can move towards the classification or types of hospitals. Okay, so yesterday only I have taught this one, even though once again I am telling first classification. Okay, so according to ownership. Okay, according to ownership or the control. Okay, according to ownership or the control, there is a classification which is that public hospitals according to this one, under this one, first one is that so in the examination also listen here while writing the examination, especially during the classification and all come, so you can write it down like this. Okay, use some flow charts. Okay, so this one you can write A. So public or government hospitals or institutions. So this is it is like for the population, entire population, which is organized by the governments. So run by the central or the state government or municipal or local bodies on a non-commercial basis. Okay, so because other institutions or the organizations, they are going to be worked for the commercial purpose. Okay, so but here what it will be happen in the government or the public sector, so those are the hospitals or the institution or the organization which they are going to be rendered by a state government or the central government, or it may be by the municipal corporate, or it may be by the any local bodies. Okay, so for non-commercial, okay, so free of cost only they are supposed to provide the treatment, understanding. Next one is that voluntary or charitable hospitals, voluntary or charitable, those will be that established and incorporate under the Societies Regulation Act. A board of trustee usually manages such kind of hospitals, means second. Okay, so in this only B, voluntary or charitable hospitals, voluntary or charitable. So which means under the board of trust, okay, trustee or the trust will be there. Okay, so trustee or trust will be there. So under that one they are going to be take caring of the hospitals. Okay, so here what it will be happen, under the regulations, Societies Regulations Act only they are going to render the hospitals. So a board or trustee usually manages such hospitals. Any kind of trust will be there, no, those trusts are going to be manages the things. Okay, so the main source of revenue are public and private donations and grants and aid from the central government or state government, and from philanthropic organizations, both national and international. Okay, so these are the hospitals. See, understand here the what we can say this one, voluntary or the charitable, by their own interest they are building. Okay, so they will do one group or some trust, so that trust they wants to do the good things to the society, they will construct the hospitals. Okay, so by the time what they used to do means, they will be the managing trustee will be there, no, he is the responsible person to take care of the hospital. So here what it will be happen, there is no need of money for the taking from the public, they are going to get the money to render this hospital from the central government, or they will be put by the source of revenue, public and private donations. By collecting the public and private donations, they used to collect and they will render the hospital. For example, in Bangalore, lot of hospitals is there. It's commercial also, non-commercial also. Some trust are managing, means especially BGS and all. Certain concession will be there for the public people. Okay, so that will be also acts as a charitable hospitals only. Okay, so the next one is that, and also they are going to get the donations from the international and national also, NRIs will be there, no, so they are also funding that one to lend a medication, means treatment to the public. Okay, the next one is private hospitals. See, under this one only, private hospitals, private. So this private hospital, so the private hospitals are the hospitals generally owned by an individual or group of people. Okay, some group of, if I am having some kind of friends, they wants to construct the hospital for commercial purpose only, it is going to be act. Okay, so this private hospitals and are owned by a individual. Either I can able to construct an hospital and I can give a care to the people if I have a all authority, or else people are like what we can say that people having one group and all, so those groups are offering and they will be do the business. Okay, so this is which one is that generally owned individual group or people run on commercial basis. Okay, so they are going to be render the hospital or the treatment on the basis of commercial purpose. Okay, for earning money they used to do the hospitals. Okay, so private hospitals are like that only, that very well. The next one, corporate hospitals run by the public limited companies formed under the Companies Act. There can be general, specialized or both. Okay, so many corporate hospitals will be there. So the corporate hospitals are the hospitals which will be formed by a certain companies. Okay, so under the Companies Act they will be constructed, and they can be general, specialized, both hospitals can be they can provide general care also and as well as the specialized care also. Okay, so nothing is there. If you understand the definition of the hospital means, definitely you can able to do the classification easily. We can move to the next one, is that after this one, corporate. So the second one, okay, so these will be comes under the according to the ownership, public or government hospital. The second one is voluntary or charitable hospital, and the third one is private hospital. Fourth one is corporate hospitals. Okay, so here 4 will comes under the ownership or the control. Okay, so first classification over. Next we can move towards the second classification according to the length of the stay. According to the clinical speciality. According to clinical speciality. So here according to the speciality, if you want, a lot of specialities are there. So according to the clinical specialties, patients are treated for those diseases such as hospital has been set up, such as maternity, tuberculosis, child health care, okay, leprosy hospitals, cancer hospital, cardiac disease related hospital, Jaideva hospitals and all, which is in Bangalore. We are going to provide a care for the heart related issue patients only. We are getting there. Maternity hospital will be there, Boring in Shivaji Nagara. For example, I am telling. Okay, so if you are studying in Bangalore, you know that. Okay, you people are going for the posting also, right? No, so if you go Victoria means lot of specialities are there, right? So burn special department will be there. Same how the departments will going to be differentiate, no? So there we are getting the tuberculosis department also will be there. So there only tuberculosis patients are going to take care, means get the treatment. Say somehow those are going to according to form according to clinical speciality. Okay, so those kind of hospitals are called as the according to clinical speciality. That is the second classification of the hospitals. Okay, don't forget that one. Next we can move towards the third one, according to the length of the stay. Okay, third classification is that according to the length of the hospital stay means either based on your chronic illness and the chronic and acute. Okay, so if it is a acute things, you are not supposed to stay in the hospital for a so long time. Okay, so that is what the long term hospitals. First one is chronic care hospitals. Okay, so the chronic care hospitals. Okay, under this the first one is long term hospital. Long term hospital. Second one is short term hospitals. Okay, so second one is short term hospitals, acute care hospitals. It is also called as acute care hospital. First we will discuss the third one is daycare hospitals. Okay, so the third one is under this one, or else you can give ABC, otherwise you will confuse. Okay, ABC you give either daycare hospitals. So daycare hospitals. First one we will discuss chronic care hospitals. As you know that this is one of the type of according to the length of the stay. Okay, so in under that one, the first one is chronic care hospitals or long term hospitals. So in these hospitals the patient may stay for a long time. For example, leprosy hospitals, who are suffering with the leprosy, they have to stay for so long. Okay, so the disease may be chronic in nature. For example, leprosy hospitals. Okay, so if the disease in their nature it may be the taking the long time, means definitely you have to go for the chronic care hospital. Okay, according to the length of the stay. Second, what is this third one, third classification. Under that again we have a three subtypes. So first one is long term or chronic care hospital. The second one is that short term or acute care hospitals. Short term hospitals are the hospitals or the clients may stay in the hospital for a short period only. For example, fever or gastroenteritis. So these are the conditions that people can able to stay for short time and they can get back to their home. Okay, so this is all about the second type, short term. Okay, next one is daycare hospital. In the daycare hospital are those where patients stay from morning to evening, as a member of family may not be at home to take care of the sick. Okay, so they can able to stay in morning to evening, and after that they can go to their home, because if there is no take care person will be there, by the time they can come and stay and they can go. Okay, so morning to evening, like that kind of hospitals also will be available under the length of the stay. Okay, so that classification. Then fourth classification is according to teaching or non-teaching facility. So the fourth classification is according to teaching or non-teaching. Okay, so read this one. According to teaching or non-teaching facility, teaching hospitals are the medical colleges or nursing paramedical colleges, the school attached to it. Okay, so teaching hospital means the medical or nursing or paramedical colleges will be attached to it, and research activities are carried out in these institutions. Okay, so these teaching means teaching and non-teaching hospitals will be there. teaching means medical college will be attached to that, nursing college will be attached to that, okay, and one more is the paramedical college will going to be attached to that teaching hospitals, okay. So there they are educating the healthcare professionals, okay. Next one is that hospital without medical college or paramedical institution is termed as a non-teaching hospital. Research activities may be conducted in this hospital also, okay, which means if the hospitals is not going to offer any kind of education for the healthcare professional, we would call it as a non-teaching hospitals. But even though there also there may be chance to conduct the research, okay, based on the disease conditions or the advancement of the care, okay. So that can be done in the non-teaching hospital also. But teaching means either they have not, they are included with medical, nursing and paramedical institutions to provide education to the healthcare professionals, and as well as there is a must and should the research are going to be conduct, okay. So now we can see the changing role of the hospital, okay. So the next topic is changing role of hospital. Hope you guys are clear with this classification, right? Okay. So nothing is there in that classification. Once you listen with your full concentration, you can tell that it will be with your fingertips, okay. So the next one is that changing role of hospital, changing changing role of hospitals are the hospital like what kind of roles are going to be changed from old to now, okay. So everything was in advanced phase, right. The olden idea of a hospital was that is a place for the treatment of the sick, okay. So now it was going to be emphasized on physical, mental, social well-being and research out to community, okay. So it is going to be reached out to community, okay, reaching out to the community, and training of the health workers and healthcare services have undergone a steady metamorphosis, okay. So which means keep on giving a training to the healthcare professionals for the advancement, okay. So the old idea of the hospitals only they are providing care to the patient, okay. So but now the advancement has been started and it was implemented also. Now we are reaching out to the community, okay, so to provide a holistic care to the people, okay. The next one is the role of hospital has changed with the emphasis on shifting from curative to preventive, okay. So shifting from curative to preventive. So which means that curative means in olden days and all, once the disease will come, if you are feeling sick, by the time you are supposed to go to the hospital and you are going to take the treatment, okay. So that is what curative, okay. After taking the treatment it is going to be cure. But in nowadays we are having an idea related to our health and we are emphasizing on it and we are going to take caring of our health, that is what preventive, okay. Before going to get the disease condition, we are going to save ourselves from the disease condition. For example, suppose in cold season and all, in olden days too much of flu will be there, okay. So there is a very high rate of cold and cough, okay, other flu sound, okay. So the next thing is that you have to understand, nowadays it has been shifted from curative to preventive. Why? Because we are providing the care which is preventive care. Okay, so you are going to get the vaccination before going to exposure to disease conditions. Okay, so those are all the measures to be taken place in. Okay, taken place. Then inpatient care to outpatient care and home care. Okay, so inpatient care to outpatient care, it is shifted to outpatient care. Okay, the next one, it is shifted to home care. So nowadays, before and all, there is no availability of the doctors, nurses in the village area, remote area and all. But nowadays it is not like that. Everywhere you are getting the healthcare facilities. Okay, so that is how it is showing and it is changing its role. Okay, so the next one is that tertiary and secondary care to primary health care. Okay, so in olden days and all, secondary tertiary care will be working. Okay, so what is this secondary and tertiary care? Yesterday I have explained. Okay, so the tertiary care means the intervention that should be accomplished in this stage of the tertiary prevention, disability, limitation and rehabilitation. Okay, once it will be going to be done with, means anything will be happen, that is going to be take care. Okay, so the next one is we have the secondary prevention, refers to the actions taken once the disease progresses or it is present in your body. Okay, but nowadays we are pushing ourselves, or we are taking the care in primary level itself. Okay, before going to arise of the disease condition, or the disease are not going to be progress, by the time only we are going to supposed to get the treatment. Okay, so that is how it has been changed. Okay, so that is the another role, that from tertiary to secondary, now it is shifted to primary. So this is the role changing of the hospital. Okay, so the next one we can see the functions of the hospital. So primarily the function of the hospital is that to provide a care, medical care to the community, and the role present in the present day hospital is divided into two distinct areas. The first one is intrinsic, intramural and extramural, which means here you can see intramural means within the walls, extramural means out of the walls. Okay, so intramural and extramural divided into two different functions. Intra means within the hospitals, whatever the functions which will be taken place by the hospital, which means the healthcare workers, and extramural means outside of the walls, which means outside from the hospital, what kind of care we are supposed to give and what are the functions will be there, that we can see. Okay, so the next topic is the functions of the hospital. The primary function is to provide a care to the medical care to the community or the people is the primary function. The next one is, here it is going to divide it into two. Okay, so this hospital function, that is what, intramural and extramural, which means inside the wall within the hospital, which means outside the so these are the two different distinct functions are divided. The first one is intramural and the second one is extramural. Intramural means inside the hospital, whatever the functions which we are going to be render and perform. The next one is that outside the hospital. Okay, extramural means outside the hospital. Intramural, okay, under the intramural, one second. Intramural, there are the functions within the hospital itself taken place. So, the first function is therapeutic. Okay, so therapeutic means treatment based therapeutic function, and under that one diagnostic, curative, rehabilitation, care of emergencies. Okay, so the first function under the intramural. Therapeutic functions, first one, curative, diagnostic, and we have a rehabilitation. So, listen here, intramural means therapeutic. First function is that therapeutic. Under the therapeutic we are going to do the diagnostic, curative. Okay, so the curative, which means the provides the treatment for all elements. Okay, so not only for one thing, we are providing a consideration of the all the things, and we are providing the treatment for that. Okay, so the next one is diagnostic. Okay, so to identify the disease condition consists of providing inpatient services in finding out the cause of all elements, which means we are going to provide services, inpatient services, which is going to identify the cause of the disease condition. So, for example, the laboratory investigations and X-ray, so on, diagnostic tests are going to be conducted in the inside of the hospital. Understood, right? So, this is also one of the function. Diagnostic services. Rehabilitation. Okay, rehabilitation means the facilities of physical, mental and social occasional rehabilitation also, which can be given in the hospital. Okay, so the next one is care of emergencies. The care of emergencies are like assist the clients in restoring the health in accidents, trauma or acute life threatening conditions. If any kind of acute life threatening conditions which will become, as well as there may be a chance to get any kind of accidents or any injury, trauma, by the time there may be a sufficient care should be needed in a very rapid way, means fastly we need to provide a care. Those kind of care services we can give in the therapeutic functions, under the therapeutic functions. Okay, so therapeutic functions, we are hospitals, these are the services they can give. Okay, so the next one is that preventive. Okay, so the next is preventive functions under the intramural. The next one is preventive functions, okay, or the preventive care we can call it. So, the preventive care is that antenatal and postnatal services, okay. So, preventive care should be provided through So, the second one is well baby clinics and immunization. Well baby and the next one is family welfare services. Control of communicable diseases, and the fifth one is health education. Okay, so the preventive functions which will be taken place inside of the hospitals, we are supposed to provide a care for the through the services through antenatal and postnatal services. We are providing a services for the pregnant women and as well as the lactating mothers. Okay, so the next one is well baby clinics and immunization in the primary health center, okay, PHC. You can go and see every Thursday there may be there will be providing the immunization, or they are working under the well baby clinics, okay. They are treating the children's, okay, under 5-year children's, they are focusing on that, okay. So, that is what the preventive function which has been done through this also. Then family welfare services like family planning and all. So, through these family welfare services they are providing under the preventive only, okay. So, in order to cover the population, okay. So, the next one is that control of communicable diseases. So, to control the communicable, to curb the spreading of the disease which is from one person to another person, that is what, right. According to communicable disease, what is communicable disease? The disease which are going to be spread from one person to another person, okay. So, that they are going to be controlled, okay. So, and health education, okay. So, regarding your health and the benefits of the treatment and as well as how to take care it and what kind of things you have to follow, all the health education which is related to all elements, the preventive function is going to be provided in the inside of the hospital, okay. So, the next one is education, okay. So, education, the next is education. Education is the hospitals are attached to the training institutions to provide the education to the students, such as the medical education, nursing education, paramedical training, and as well as the research. Okay, education, this functions also which will be taken place inside the hospital only. Okay, so the first one is that providing training through medical education. Yes, of course, the hospitals or the factories or the institutions, they are going to be prepare so many doctors. Okay, so they will provide education for the doctors. Okay, the next one is our profession, that is what, nurses. Okay, so the nursing education. Okay, so nursing colleges will be attached to the medical hospitals only to get the training. Okay, so the next one is paramedical training. Paramedical training. Okay, so fourth one is that, which is what we can say, the fourth one is research. Okay, so the research also will going to be conducted in the hospital only. Yes, no? So BMRCI, which means Bangalore Medical College of Research, like that only, research institution and center will be there in the hospital itself. Okay, so that is how the functions in the education form within the hospital will be taken place. First one is medical education, which is attached to the hospitals to make the, to provide a teaching training to the doctors, and nursing colleges, this also to train up the nurses and provide education to the nurses in a simulation way. Okay, so you have to learn through 1:1. One patient means patient contact is very important. With the patients only you have to learn your practical. Okay, so that is how it is going to be attached. Okay, so that kind of educational services which will be given inside the hospital. The next one is paramedical trainings. Okay, so which will provide a training for the paramedical, like lab technician, x-ray technician, so on, so on, so on. Okay, so the next one is research. Research is also going to be conducted in the hospital. Okay, is to advance the modalities of the treatment from one day to another day. Okay, so this is what the functions in the education inside the hospital. The next one is only in education, this one, this is the D. Okay, so last function is research. Okay, so we are here, we have in the function intramural and extramural. Intramural we have finished. In the intramural, the first one is therapeutic. Under the therapeutic, diagnostic procedure will be taken place, curative services we are providing, rehabilitation we are providing under this one, and care of emergencies also we are providing. Okay, so that is all about the treatment based, therapeutic based functions inside the hospital. Okay, so the next one is that preventive. Under the preventive, we are providing the services through the antenatal and postnatal services and family welfare services and controlling of the communicable diseases, and as well as we are going to do the provide a health education. Okay, so and well baby clinic and immunization also will going to take place in the preventive functions. Okay, the next one is education. When it comes to the education, we are providing education to the medical, means hospitals are attached with the medical colleges, nursing colleges, and as well as providing training for the paramedical staff. Okay, so the students. The next one is that last function is research. Okay, the research is in various areas of medicine and nursing is conducted in the hospitals. Okay, so that is what research, that is the last function inside the hospital has been done. Okay, so the next one is that extramural functions. Okay, so the extramural functions, here there is no proper, like not this much of functions which would not be taken place in the outside. So the next is extramural functions. Okay, in the extramural functions, very first, those are the functions which is extended outside of the hospital, which means outpatient services. The next one is home care, outreach services, domiciliary services, then school health services and industrial health activities. Okay, so which means outside of the, means this is a hospital. Just you assume, okay, I am not a good drawer. So here you think this is a hospital. Okay, so in this hospital, from outside of the hospitals, outpatient services. Okay, so the next one is they are going to provide a outreach. And they are going to provide services like school health services, home care or domiciliary care. Next one, they are providing the school health services. So the next one, you guys are going to provide doing the industrial activities. Okay, so these are the activities which will be taken place outside of the hospital. We will call it as the extramural functions. Okay, so my dear students, we clear with the functions of the hospital. Okay, so next we can move towards the departments of the hospital. Okay, so departments of the hospital, clear with this point now. Next we can moving towards the departments of the hospital. Departments. So the departments is, first one is outpatient department, first one only I will tell, then later I will give an explanation regarding that. So what we will call, that is OPD. OPD, which means outpatient department. Okay, so in hospital certain departments will be there according to their own prioritized care. Okay, so very first, outpatients are go to hospital just for diagnose, treatment and therapy, and they leave without staying overnight. Okay, so only they used to go to know what happened to them, and they have to take the treatment, and they will be get back to their home without staying in the hospital. Okay, so that is what outpatient department. It is the first point of contact in the hospital. Generally people used to go for the consultation, then after they will doctor will decide the modality of the treatment, mode of treatment is going to be performed. Generally located in the entrance of the hospital. Okay, it is located in the hospital. OPD should have an inquiry where the patients is get guidance, and other required facilities in the OPD are like waiting area should be there, consultation rooms should be there, sign-in boards should be there, toilet should be there for separate male and female. Okay, so in boards indicating the facilities rendered in that particular hospital and names. Okay, so these are the things they are going to be taking place. Okay, so the next one is that we have certain following services which will be given in the outpatient department. Once again I will explain certain departments. Okay, departments in the hospitals we are studying that one. In that, the first one is outpatient department. In generally, while going to the hospital, this is the initial area where we are going to get the guidance from the doctors. Okay, so generally we used to go to the hospital. So how it has been designed means one inquiry unit should be there. Okay, so the receptionist to some people used to there, and they will give the information related to where you have to go, and you have to do some certain things like appointment taking or registering your details. Okay, so these are the things which will be there. Based on your requirement, they are going to be tell where which OPD you have to go. Okay, so the including this one, this OPD services including consultation with the doctor, you can consult the doctors here and undergo investigation. You can done the diagnostic investigations with the order of doctor. The next one is undergo minor procedures. If any kind of minor dressing and all will be there, means they can do. for example, for female and all, they can do some auscultation though, or else they will do some PV and all when it comes to gynecological OPD. Okay, these are the things which should be taken place in the OPD. Then receive specialty services. Okay, the next one is specialty services you can receive here according to your specialty. Okay, which means your clinical specialty problem, you will get the specialized care over here. The next one is receive her rehabilitation services such as the physiotherapy, occupational therapy. Okay, so you will get rehabilitation to bring back your health, you will get the physiotherapy or occupational therapy kind of treatment. Okay, next one is health education, counseling, and as well as the receive a preventive and promotive health care provided in the various clinics such as the antenatal, postnatal and immunization clinics. Okay, so you are going to get the preventive and promotive care in the OPDs also. Okay, when it comes to maternal and child department, no, so definitely you will get all these services over there. Okay, so different departments will be there in the hospital. Medical surgical OPD will be there, obs and gynae OPD will be there, that is what maternal OPD. The next one is ophthalmology, which is related to eye, and ENT, which is related to ear, nose and throat. Okay, example I am telling, pediatrics related to child, and orthopedic which is related to bone issues, and cardiology which is related to heart, neurology which is related to brain, and urology which is related to kidney, and nephrology and urology, sorry, nephrology which is related to kidney, urology which is related to your bladder, and the next one is that psychiatry will be there and neurology will be there. So different speciality OPDs will be there. We are done with the OPD. OPD means outpatient department with a lot of speciality services. Okay, so this is the only the criteria of the OPD. Okay, so all these things are finished. Now we can go to the next department, is that emergency or casualty department. Okay, so emergency or the casualty department. So this emergency or the casualty department, it is located in an area which is easily accessible to the patient. Okay, most of the time downside only which should be there. Emergency department should have sufficient medical and nursing personnel. Okay, so why? Because in an emergency situation there is a sufficient staff should be there to provide a care, okay, in a rapid way. Okay, so fast action should be there in that. And here the next is inpatient, means casualty and all is some emergency situations like breathlessness, breathing difficulty, accident patients. So those kind of any trauma, injured patients will come to casualty or the emergency. Okay, so the next one is that inpatient services. That is what the next department is, inpatient services, which means inpatient services means inside of the hospital they are going to be stay actually. So we will see that patients who require the continuous medical care for so long or acute, okay, for such a duration, we are going to provide the care and attention, are admitted in the hospital and they are stay overnight or for several days also they may take, or weeks or months, or for diagnosis and treatment or therapy. Okay, so for the continuous care, inpatient department will be there in the hospital. Okay, so here they are providing the services, dietary department and pharmacy and other paramedical staffs are needed to supervise this, means provision for this rendering the care in the inpatient. Provision for investigation, radiological and laboratory should be available in the hospital. So that is how the inpatient department has been depending on the other departments also, like radiology and as well as the laboratory, X-ray and all, to diagnose and frequent continuous monitoring of the patient to provide a treatment. Okay, sufficient staff should be also needed. The next one is operating room complex. Okay, so in here only, in this particular inpatient department only, combined with the operating room complex. Okay, so operating room complex which will be there, it is located in an area which is least contaminated and part of the same easily accessible. Number of operating rooms depends on the facilities and departments available in the hospitals. Okay, so which is always means easily accessible area, and which is zero contaminated zone only, they are going to construct the operating rooms. Okay, so which is near to this inpatient services only. And the next one is nursing departments. So when it comes to fourth one, okay, so the fourth one is nursing departments. So the fourth one is nursing department. In the nursing department, we have that consist of nursing services and nursing education. Okay, so the nursing services, we are supposed to go and give a nursing services care. Okay, and we have a organizational structure for the nurses to provide a nursing care and to patient is in various departments of the hospital. The head of the nursing staff is nursing officer or nursing superintendent, such as as per the organizational structure of the personnel, the department include assistant nursing superintendent and nursing supervisors, head nurses, staff nurses. Okay, so which is all related to the nursing team. Okay, now, okay, so organization of the hospital. So two hospitals will come. So first one we will see that organization of the public hospital. So when it comes to the public hospital, here you can see first Ministry of Health and Family Welfare. Okay, Ministry of Health and Family Welfare. Okay, so Ministry of Health and Family Welfare. Okay, this one will come. The next one is Secretary to the Health and Family Welfare. Okay, so Health Secretary. Health Secretary. After this one. Okay, so the next one is that District Health Services or District Medical Education will come. Okay, so the next one is District Medical Officer. Here District Health Services. That department will come a District Health Officer. After District Health Officer, Hospital Superintendent. Okay, so Hospital Superintendent. Okay, so the next one is that under this one Hospital Superintendent, one Medical Superintendent will come, one Paramedical in charge will come, and one Nursing Superintendent will come. Okay, so till here you understand. First once again I will explain. So first Ministry of Health and Family Welfare will come, and the next one is Health Secretary, which is related to the Ministry of Family and Welfare. The next Health and Family Welfare. The next is that District Health Services. Okay, so District Health Services, which will become District Medical Education. The next one is that after this department we have a District Health Officer. Okay, so under that one Hospital Superintendent. Okay, so Hospital Superintendent. So this Hospital Superintendent is going to be and if you have any doubt you can contact to us. Okay, thank you so much for watching our live. We will meet in the next class. Signing off, Nursing Guru. Thank you.